Hi there, it's Dr. Harris Meyer coming to you with another wellness moment from San Francisco. Today I'd like to discuss an article entitled "Think Twice Before Taking Popular Heartburn Drugs." And this article explores the effects of the drugs Nexium, Prilosec, and Prevacid on the people who have taken them long term. And these drugs are part of a category called proton pump inhibitors, or PPIs, and their goal is to reduce the production of stomach acid. So what the studies found, and they were published in the Archives of Internal Medicine, and there were a handful of the studies, and this is recent research. They showed that women who were postmenopausal had a greater likelihood of breaking bones when they were on these medications, and people who were hospital-ridden had a greater incidence of getting bacterial infections or reinfections. And so we look at some of these risks, and those were just some among several. We want to consider trying to address these conditions with a more natural method. And in some cases, for simple cases of heartburn, people run to Tums or Pepto-Bismol or other over-the-counter medications or even prescription meds. They might be able to get rid of those symptoms just by lying on a couple of pillows when they're going to sleep instead of laying flat. As a chiropractor and as someone really concerned with wellness overall, I'm afraid to even mention ways of just dealing with the symptoms, because my goal is to try and get to the root cause of the problem, try and alleviate that if possible, and if we do that, then of course the symptoms will go away as well. Also, something like laying on a couple of pillows in bed can have consequences to your spine and to your posture and your nervous system in that way, and so I don't want anybody to make any changes without talking further with me or with your doctor about how to handle these things. But suffice it to say, if we take a more natural approach, we certainly won't have to worry about some of the dangerous side effects that a lot of these medications have. So in my clinic, we have many people who have come to us with digestive problems, including ulcer, GERD, and heartburn itself. And what we find is that with dietary changes and with chiropractic care and recommendations, that in many, many cases we're able to have people eliminate or reduce the medications that they're on. We've helped to solve the problem so that the symptom then goes away. So if you or somebody that you know is interested in finding out more about how we manage digestive conditions or wellness in general, then please give us a call. We can be reached at 415-956-3226, or you can look us up on the web at www.bodyfocushealth.com. Thanks for watching, and we'll see you next time.